Welcome back. Now, as we enter our second week of level 5 restrictions, anxiety levels among kids need to be monitored, and it's important to answer as many of their questions as you can.
Lecturer in psychology and early childhood education, Dr. Mary O'Kane, joins us this morning with some helpful advice on how to talk to children about COVID and how to help them ease their fears. Good morning to you, Mary. Thanks for being with us.
Morning.
I suppose the hint there is in our introduction, how to talk to children about COVID, because a lot of times we tend to wrap them up in cotton wool and want to avoid that conversation, especially when they're younger.
Laura, that's exactly it. That's the first message. Do it. Because we think, say nothing, if they know nothing, we brush it under the carpet. No, actually just talk about it. But they feed off us. They take their tone from our tone. So if they hear you saying, don't touch anything, don't touch that, you'll get germs off that. You're actually telling them, ooh, this is scary, I need to be scared of this. So we need to be positive. Even if we're feeling a little bit anxious ourselves, it's really important that we show them that, no, we can cope with this, we can deal with this.
Well, they're all very much aware of it anyway, because the whole hand washing has been, listen, I'm sure parents all were into hand washing before, but it's ramped up a level with hand sanitizers, trying to maybe not even play with their friends as well. But you think, at what age group? Because you have different children, different ages. How do you kind of mix up the messages?
Well, funny, we were just saying the preschoolers are aware of COVID. I mean, they're using the language. Preschool practitioners are telling me that the children are coming in and they're playing, we'll play hospital today. Oh, he's got COVID, and they're taking the baby has COVID. They know the words, they know about washing their hands. So I think if we are talking about it in a calm way, generally in our conversation. So instead of that message, be careful, if we say, yes, we wash our hands to make sure we keep the germs away, don't we? And we keep a bit of space, so we're doing it just in a positive, calm way.
We didn't mention it in our house at all, and obviously it's come through to my daughter, who's in preschool as well, who said, don't touch her little brother, he's got coronavirus. And it hit us a bit of a shock, because we've tried to distance it and not bring it up.
Yeah, she's so little,
but you think it is important to just open up about it and show them it's not something to be scared of, maybe?
Yes, and in a way, by doing that to you, she's putting it out there. He has corona, but she's also sort of relieved then if you laugh or you go, no, the baby doesn't have corona. You're relaxed. Like if you'd gone, oh, the baby could have corona. It's like, in our mind, it's like, oh my God, this is really bad. Like, they test us. They do in these ways. Play is how they learn. And these playful interactions, like even maybe pretending maybe the baby has corona, be with me, not him sometimes
as well. Be the doctor, be the nurse.
Exactly. It's how they're learning, and they're also really processing any fears by doing that.
Mary, can we talk about families that have multiple children in them? So perhaps there's 3 children in a family, 2 are getting on fine, they're a bit older, they understand the meaning, the ramifications of coronavirus, and they know that it's a temporary thing, it's not going to be forever. You tend to sort of parent your children the same. What if the 3rd child has more anxieties and is reluctant to say so because nobody else is voicing their concerns? So how do we make sure that we're aware of what that child might need, something a bit different to the other children?
Yeah, I think that can happen a lot, Laura. A lot of us would say we have maybe one deep thinker in our children, and that's the one who will always preempt things, and they're overthinking maybe a little bit. And the most important thing is time. It's us. So what I would say, it's not even, be positive in what you say, but more important is that they have you. We are the most important connection in their world. They feed off us. So we always say for each child, and I know it's difficult with a baby, but for each one to try and have a bit of individual attention is really important for each child. But it's just that bit of one-on-one. The Halloween break could not have come at a better time.
Really?
I think we need it, and our children need it. A bit of fun in their lives, a bit more time with us, connection. And I know people have said, oh, there's no trick-or-treating. No, this isn't normal Halloween. No, it's not normal, but it can be a really fun Halloween. It definitely can. So maybe going back a little bit to tradition and going back to the old-fashioned Halloween.
What we're seeing, we were talking about pen pals earlier. There's lots of things about stepping back, and there's nothing wrong with that. And you can still watch your Netflix, watch a few scary movies and stuff like that as well.
Yes. Oh, definitely. Tommy, now this, again, it helps them process all this Halloween stuff at the moment. We were talking about Frozen, off go Anna and Elsa. But they realise they have inner strength. They're brave. They realise that sometimes the world can be a little bit scary, but we can cope. really good for our children to think about those
And
messages.
try to really enjoy enjoy Halloween, enjoy this
yes.
week, the build up to it, and try and take away the anxieties of maybe what was going on in school.
Absolutely. And it is the old-fashioned stuff. You know, the pumpkin carving,
Yeah.
it's all these, and the spooky stories, and the bobbing for apples, the things that I did when I was a kid. But we're allowing them to do them again. Trick-or-treating can take place in different ways, you know. I heard a lady was telling me yesterday, in her little estate, they're hiding pumpkins in the gardens, and when the kids go around, they find a pumpkin in the garden, their own parent gives them a treat. Isn't that lovely?
Have to adapt.
We have to be inventive.
You absolutely do. How important, Mary, is projection between adults and children? And how important is the language that we use? You mentioned the Halloween midterm break. A lot of parents would say, oh, we can't even do anything. We can only go within 5 kilometres, not realising little ears are listening.
Yeah.
Yeah. No, and again, well, funny, the projection thing, first of all, it's just so true. They feed off us, and if we become an anxious parent, we are going to have a more anxious child. And I know one of mine struggles with anxiety, and the message to me is, be brave. I have to tell myself before I tell her that, we have to sometimes remind ourselves, you know what? No, we can do this together.
Yeah.
We can still go outdoors. The weather isn't too bad. It wasn't great earlier, but it's much better now. We can still get out and about. It's supposed to be good on Halloween, fingers crossed.
Yeah.
But there is stuff we can do in our 5-mile radius. Getting them out, walking the legs off them can be good. Come back, roasting marshmallows, snuggling up together in front of a fire. Connection, family connection.
But be careful what you say, because a lot of people, everybody's talking, this is the new normal. Or, husband and wife speaking to each other going, this is rubbish. And exactly as Laura said, that there are ears, they're always listening.
Yes.
And that could be terrifying for certain kids that are and maybe don't talk to their parents, or they're not opening up with it.
I hate that new normal.
Yeah.
This isn't our new normal. This is temporary. It might not feel like it at the moment. I know, we all have times we go down. Our kids regress, we regress a little bit, and we sort of pull back. But this is temporary, and we need to make sure we're making that clear to them too.
Looking at the wider sort of system that's in place at the moment, and so many children are missing their extracurricular activities. There have been plenty of birthdays celebrated in lockdown, perhaps not being able to see Nana and Grandad, to see cousins. And so because they don't have a concept of time, I find it's quite tricky to explain to them, yes, it's temporary, but because I don't have a finite answer for them when it's going to finish. It can be very difficult to keep their spirits up on occasion. And I see at home, they're usually in great form, but the odd day there's a bit of a slump, like there is with adults too.
Yeah, exactly. We are the same. I mean, definitely, I don't think any of us is performing at 100% at the moment. So it's natural that they're not. And there's no easy answer for that one, Laura, other than in fact, getting them back to school was a positive. And I know that parents have concerns about school, but for their balancing their mental health with their physical well-being, having them interacting, that social interaction, the friendships are really important. Normality, they need some kind of normality.
Structure,
Yeah, what sort of tips do you have? You can see there are some tips there for parents with their kids going back to school and being in school, because, listen, they're all having to wear face masks. There is that anxiety as well.
And it's empathy. So, and again, validate their feelings.
That's really interesting that you have that down. So can you explain what that is? So it's not rubbishing what they're saying.
Oh, no, exactly. So you might not feel the same way that they feel. So they might feel a bit anxious about going in, oh, there's germs, and if there's germs, I'm going to get sick and I'm not going to go to school. And if they have that thought, the germs can make me sick, that has a physical reaction. So they're feeling, their arms are a bit shaky, their tummy is a bit funny. That makes them potentially not want to go. So we don't want to dismiss, we want to empathise. I can see this is hard for you. You look worried. Tell me, what's going on with you? Are you worried about school? So you're feeding off, looking at what's happening with them and asking them how they're feeling. But also, you are showing confidence. I can see how that's scary, but I'm not worried. I know that you're doing hand washing in school. I know that teacher has you in your pods. I know that the principal has been thinking about how you'll stay safe. So you're showing empathising, but showing confidence.
Yeah, listen, I was never the best student, but I loved the after-school activities, and that's something that's really been hit hard at the minute. A lot of them are being cancelled, and it's shown how it can improve confidence in kids. It is so many good. How is that in terms of a challenge for parents with children?
Oh, Tommy, it really is. Our children, our teenagers, our young adults have given up so much. I think sort of in my age group, we haven't given up as much in our lives. They've lost out on so much. That's why I think having them interacting in school is so important.
That friendship connection at teenage level, it's vital for them.
It's what they should be doing. They should be out there testing themselves, experimenting, finding their confidence, their independence, that they're losing an awful lot. And there's no easy answer to that one, but the sooner the better we get that generation back engaging for their mental health. It's definitely important.
Yeah, it really is.
Mary,
Difficult
thanks
times.
so much. Some great tips, and sure, we'll shoulder on. Keep going. And I suppose we're all responsible as parents and guardians for minding the little ones and making sure that they feel secure, happy and safe.
I think the message really is just, feel free to be open, talk, don't try and brush it under the carpet. It's something that Irish people are so known for. But
and have a bit of fun this Halloween. Have good family fun. It's what we all need.
It is, you're right. We need the lift. Thank you, Mary.
OK, right.
Now we're going to take a quick break. We'll see you in a few minutes.